My biggest fear about going and getting help was that they were going to take my baby away from me.
Yeah.
And actually, when I got the right help, that was the last thing that they would have done. And they said to me, you know, that would be absolute last resort.
Yeah.
We would do everything we could to help you and your baby be together, because that is what you want, that is what you need, and your baby needs you. And you know, you might not feel very present at the moment, but you know, just go through the motions, do those things that you're seeing other mums do, because you'll have you'll always have that memory. And that was what someone always, like, I remember someone saying that to me, and that'll always stick with me, is that I do actually have some positive memories from when she was tiny, just because I just went through the motions. And
I think it's hard that we you know, like we read in the media, oh, this person killed their baby, they must have had postnatal depression, and it makes you not want to share your thoughts. But I think in hindsight, like, my psychiatrist was amazing, because from the beginning I was so honest with her what I was thinking, and she never batted an eyelid. You know, and never. She said, I'm not concerned about this. This is part of this is part and parcel of what you're going through, and that's such a good thing to hear.
I didn't even know how to tell anyone, and I was seeing a perinatal psychiatrist because I was being monitored because I have bipolar disorder. And when I said it to her, I said, you know, and I tried to play it down, because I thought, she's gonna think I'm gone, you know, I've gone crazy again. And she said, no, that's really normal.
How old was your child then?
She was maybe a few months old.
So it didn't happen straight away?
No, well, it was growing, but there was so much going on, you know, that kind of overwhelming.
Mine came on really suddenly as well, really. Had a really lovely pregnancy, really enjoyed it, and I couldn't wait for my son to be born. And yeah, had a good birth, well, as good as it can be. And I was fine for about 4.5 weeks, you know, breastfeeding. I thought, oh, I've nailed this is all right. And then I woke up, literally went to bed, and I woke up the next day, and I thought he'd been contaminated with asbestos for no particular reason, actually, just a bit of plaster had fallen down from my ceiling. From then on, like, my thoughts were around he'd been contaminated and I hadn't protected him.
And it was just like that overnight?
Yeah, overnight. And I've had problems with anxiety in my life, but I've never had intervention from a mental health team, or, you know, it's just something that's part of my character. I just had a doctor's appointment, and I said I want some sleeping tablets. I'm not sleeping. You know, I can't cope with this. And from there, they could see that wasn't quite right. So I got help really quickly. So I was quite lucky in that respect.
It is a luck thing sometimes when it comes to that.
See, I don't think that if I made enough noise and shouted and screamed and got really crazy about how poorly I actually was, I would have got the help that I needed. I told my health visitor, I told the midwife who came a few days after that I was having these, you know, I said, I'm having a few peculiar thoughts, and she said, oh, it's the baby blues, you know. And I was like, this is not the baby blues. And then it got to a point where I literally couldn't cope anymore. So I went to the GP and I took my mum. I had a really supportive family, and she said, oh yeah, it does sound like you've got postnatal depression.
Because of the medication they put me on, I had to stop breastfeeding overnight, really. And in a way, my anxiety sort of turned into a spiral. So whilst I wasn't depressed in the beginning, I think I became so upset by how my kind of experience of motherhood was turning out.
Yeah,
you know,
it's not the dream.
No, and I began to feel, you know, really isolated from other mums. And although I'm really open about what happened, you know, being around mums that were coping, it would turn into this, what's wrong with me, which I don't think helped on the depression side of things. And I ended up getting really pretty depressed about it all, really. But definitely. I
went to a postnatal sort of support group when my daughter was about 3 or 4 months old. And I met a group of friends there who, you know, I'm still quite close to. A lot of
was it a mental health support group?
No, it wasn't.
Just general?
It was just a general one. Yeah. But it was so useful because it wasn't sort of like antenatal classes where you're preparing for this event. It was about talking through your experiences of becoming a mother, and it was about adjusting to it. And I found that, you know, there's a bunch of women there who, you know, all had these, from the outside, had these great lives, perfect lives, everything fine. But then when we all started talking, we were all experiencing really similar things. Maybe not to the same degree, but there was a lot of doubt there. There was a lot of adjusting to being seen in society as a mother.
With postnatal depression, something I was always told was you'll always get better from it. It's one of the mental health illnesses that you will get better from with the right help. And these mums that kind of act on impulse because it's so real for them, and then they take that step and they'll never know how amazing it is to actually be a mother and to feel the love. And
I find that so sad. Like I just remember, when I was really, really ill, just thinking my brain is broken. Like I was struggling to talk. I couldn't even really have conversations. I couldn't make a cup of tea. It was, and I love my husband and I love my son, but I just thought I can't go on like this. And I never would have thought I'd get to the place where I am now, like so happy, just so happy in my life. And I just find it really upsetting that if people aren't helped, what can happen?